Hello everyone, welcome back to my YouTube channel. Today we are going to talk about a critical health topic that affects millions of people worldwide, which is oral cancers. The oral cancers also known as mouth cancers, and they can occur anywhere in the mouth including lips, tongues, cheeks, gums as well as in the throat. So in this video we will explore the causes and symptoms and signs as well as how we diagnose oral cancers and the treatment options. So, let's get going. So, what are the oral cancers? The oral cavity extends from the mucosal surface of the lips to the junction of the hard and soft palate. This does not include the soft palate, uvula, or tonsils. The most common type of oral cancers are the squamous cell cancers. Nowadays, oral cavity cancer is eighth most common cancer worldwide, with an estimated 350,000 cases arising annually. When we talk about the risk factors, we can divide those risk factors broadly into four categories. Those are environmental factors, genetic factors, age, and the other factors. Environmental factors are there are several viruses like human papillomavirus, fungal infections, bacterial infections, occupational risk factors, as well as poor oral hygiene. The other risk factors are usage of mouthwash, diet and nutrition, betel chewing, as well as alcohol drinking and tobacco smoking. Those are the most common risk factors for the oral cancers. So, what are the signs and symptoms of oral cancers? First, we will see what are the symptoms. There can be swelling of the neck or bleeding from the gums, and also sometimes you may feel cancerous growth on the lips, and also sometimes there may be difficulty in wearing dentures, as well as there can be non-healing ulcers of the tongue. Those are tongue cancers. And also sometimes there are non-healing ulcers over your lips. Those can also lead to oral cell cancers. These are the several other signs and symptoms. So when we talk about the signs of oral cavity cancers, there can be non-healing ulcer which is more than 2 weeks. There can be persistent neck mass which is maybe due to neck lymphadenopathy. And also sometimes there can be lesion pigmentation with progressive increase in size. Sometimes there can be lesions with associated induration. Also there can be red or white lesions, and also sometimes there can be non-resolving inflammatory lesions as well. Sometimes soft tissue lesions with associated with radiographic changes are also leads to oral cell cancers. And also if you have unexplained tooth mobility, it also leads to cancers in future. These are some diagnostic methods of oral cancers. First, we have to do FNAC or fine needle aspiration or a biopsy, and also several blood investigations. We can do imaging like CT scan or MRI scan. Like that, we can diagnose oral cancers. How do we manage oral cancers? There can be, or we can do surgeries with adjuvant chemotherapy with radiotherapy.